A new law in Arkansas puts maternal mental health into focus. The measure requires moms to get screened for depression within weeks of giving birth. And the law comes as family welfare advocates call for a closer look at mental health and well-being during this critical time.
And joining us now is the lead sponsor of the bill, Arkansas State Representative Pilkington. Good to see you, Representative, and thanks for being with us.
Good to see you as well. Thank you for having me.
All right, so this law kicked in January 1st. Break it down for us and tell us why it's needed in Arkansas.
Sure. Well, Arkansas is one of the states with the worst maternal and infant mortality rates. And so looking at ways to improve that is something I've spent a lot of years and a lot of time doing. And one of the interesting studies that actually came out from the University of Arkansas for Medical Science was a study about maternal mental health and ways to improve it. And so to me, this seemed like a golden opportunity to put something in place that would help out our mothers here in Arkansas, help them get the care they need. And so we designed a law that essentially would cover these services, require that they're provided, and that their insurance is paid for, whether it's private insurance or Medicaid, and make sure that the providers perform it. And so by doing this, we're hoping to turn the curve when it comes to mental health in maternity cases here in Arkansas, and I'm really optimistic about the possibility of improving mental health for young moms and all moms really here in Arkansas.
Yeah, I mean, this is so critical. As an OBGYN, I know unfortunately that psychiatric issues are a leading cause of maternal death and morbidity, as you said, during pregnancy and postpartum. So specifically, we get the concept, but how do you think this law will turn things around?
Well, I think by one's pain, you're going to see providers offer the service more and more. You know, Arkansas is a state that doesn't have as many providers as we need, so oftentimes they're overworked, they've got a lot going on. But when you reimburse it, you're likely going to see an increase in this provided. And with this law, they have to require it unless the mother opts out. And so by doing this, we're just hoping to catch things early on, not let this important part, which is the mental health screening, fall through the cracks. And, you know, if we're able to catch this early on within the first 6 weeks, the hope is that we're able to get mom the care she needs so that she can have a healthy postpartum time with her new baby. And, you know, I tell people all the time, this it not only helps the mother, but it helps the child as well. If mom is having some issues, you know, her getting the help she needs is vitally important to make sure that that baby gets the help they need as well. So a good environment for mom is a good environment for baby. And so we think this is both pro-mom and pro-baby. And so we're very happy about that.
Let's be real, babies are expensive, and a lot of families, they just don't have a lot of extra money right now. So I'm curious, who is paying for this?
So what we're doing is we're requiring the private health insurance to pay for this, as well as requiring Medicaid in Arkansas to pay for it as well. So it isn't coming out of the pockets of the moms, it's coming out of the insurance pockets, which is an important part of this. You know, we could say that, oh, we want this covered, but if no one's going to pay for it, it's not going to get done. And so that was actually a vital part of this bill, was making sure that it's getting covered. And so that's our hope. You're right. It's expensive to have children here in Arkansas. I've got two. I've got a third one on the way. It's pricey for sure, but we wanted to make sure that these screens are being done because, you know, having a child, I mean, that's, you know, it's a beautiful thing, but it's life altering. It's a very stressful time. I mean, with our first child, it was during COVID. We had a C-section at 11:30 at night. I mean, it was a very traumatic time for us. And I just remember sitting there the next day holding my baby as my wife slept, just thinking, how do some of these people go through this, especially single moms and moms that don't have the support system that my wife had. And so it really broke my heart when I thought about it. And I just thought, you know, you come home with a new baby, your life's completely changed, maybe you had a C-section, you know, that's a whole complication in and of itself. And so, you know, is anyone ever asking mom, hey, how are you doing? What's going on with you? Are you feeling okay? And like I said, because this is a very, in some cases, traumatic time when you're giving birth, especially your first time, you know, some of these mental health issues that may have been underneath the surface or maybe not dealt with, they can rise up. And so this is a good time to get those issues addressed, you know, make sure that you're getting referred to a provider, a mental health provider who can help take care of these issues. And so that's our hope, is that we kind of get people on the right track, and so that we can catch this early on and make sure mom's being taken care of.
Well, Arkansas State Representative Pilkington, thank you so much for being with us.
Thank you. Appreciate it.
And this programming note, be sure to catch the important ABC News report on women's reproductive health On the Brink tonight on ABC at 8 p.m. Eastern.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.